Good morning. My name is Dr. Mary Brown Walker, and I'm the CEO of GreenBax Health Solutions. And with me today is our office manager, Solomar Martinez. So today we're going to be covering the first session of a 3-series session on providing virtual community health to our hard-to-count communities. Our expectation is that you're going to learn about how you, as census workers, are going to be able to provide valuable information to those individuals that you are having the opportunity to come in contact with. So our talk today is called COVID-19 Updates. The objectives of this talk is to define what COVID-19 is, how it's contracted, and how the disease is spread. We want to discuss communities that are affected the most by COVID-19, define a term that's called Social Determinants of Health, review the percentages of COVID-19, the deaths related to social determinants of health, a list of signs and symptoms of the infection, and explain recommended guidelines that have been provided to us from the CDC on COVID-19. And we want to also explain those recommended guidelines from the actual infection of the disease COVID-19, and then discuss the process for seeking medical care. Okay? So the first thing we want to do, since this is an interactive presentation, we would like for you to answer a question. And you will do this by some cards in your hand. They are labeled A, B, C, and D. So for this question, which is question 1, COVID-19, which is coronavirus disease of 2019, can best be defined as a mild to severe respiratory illness that is caused by a coronavirus called SARS-CoV-2, and SARS stands for, I'll come back to that, and be transmitted by contact with infectious materials such as respiratory droplets or by contaminated objects or surfaces, or C, a serious disease that affects all ages from infancy to elderly, or all of the above. Answer with your card. Just hold up the answer, A, B, C, or D from your cards. Did everyone answer? You only have 10 seconds. 5, 4, 3, 2, 1. The answer to the question is all of the above. So let's go more into detail about COVID-19 coronavirus disease. So first of all, this disease, and I'm not sure if you all are aware, but this disease started in China. It started back in December of 2019. It's a mild, severe respiratory illness. And it's caused by this newly discovered coronavirus, which is that SARS stands for Severe Acute Respiratory Syndrome, but also COVID virus 2. Okay, so it's a coronavirus 2. It is transmitted by contact with infectious materials or with objects or surfaces that has been contaminated with that material or that virus. It is spread by droplets. So when I say droplets, I want you to really understand what I mean by that. So earlier I was explaining that when a person is wearing a mask, and if they're speaking a lot, we generate a vapor. And so that's why it's important that I keep on my mask so I can prevent that vapor that I'm creating spreading to you. The other thing is, you could cough. If a person coughs, they also are expelling that vapor from their mouth. If a person sneezes, they're expelling that vapor from their nose. So, and those are called droplets. And those droplets, depending on the force of the cough, can go as far as 6 feet. Or in this instance, through the vapor, my mask conceals it right here within my confines. That's why it's very important that you wear your mask at all times. So how about another question? What communities do you think are affected the most by COVID-19? What communities do you think are affected the most by COVID-19? A, most cases have been found in predominantly white communities. B, most cases have been associated with predominantly black communities. Or C, most cases have been reported to affect all communities equally. Or D, most cases are identified in black communities, however, Latino communities have shown an increase over the past weeks in the numbers of confirmed cases. Okay, everyone has answered, so we'll move on. The correct answer is D. Most cases are identified in black communities, however, Latino communities have shown an increase over the past weeks in the numbers of confirmed cases. So communities that are affected, black communities on the south side make up the majority of the population in 7 of the 10 zip codes with the most deaths. So black communities, I'm going to repeat that, have been identified with the majority of the cases in 7 of the 10 communities that have been identified. And 90% of Auburn Gresham, which is also a community located on the south side of Chicago, 90% of that community is black. And it includes Chicago zip code with the most COVID deaths, COVID-19 related deaths. Okay? 2 of those 10 zip codes that I'm referring to were majority Latino, and the other 8 zip codes were split totally equally between Latino and non-Latino black Americans. You should be to a slide now that is blue and showing you a series of graphs. This is the COVID-19 case rate by race ethnicity and this was actually in the earlier part of this month, so this is back in May. So there has definitely been additional cases reported at this time. So those slides I don't have available currently. But as you can see, in terms of peaks reported during this time, it's Latinx or Latinos whose case numbers were the highest. But if you flip to the next slide, this is in terms of the total that was related to COVID-19. And as you can see, the black communities are showing an astronomical increase in proportion to other communities in terms of deaths that have been related to COVID-19. So let's engage you again. Next question. Social determinants of health can best be described. So if you have not heard of this terminology before, social determinants of health, kind of just break it down in terms of what does the terms mean to you in terms of trying to figure out what the best answer is for this question. A is a condition in which people are born, grow, live, work, and age. Or B is circumstances shaped by the distribution of money, power, resources at global, national, and local levels. Or is it the availability of resources to meet daily needs, such as safe housing and easy accessibility to healthy food, or all of the above? Very good. The answer is all of the above. Not all of the answers will be all of the above, but I think we're running a record here now. So yeah, all of this. Determinants of health definitely impact hard to count communities. Because when we talk about social determinants of health, look at those stems that we talked about in that question. But even more so, the next slide. The conditions in which people are born, this is social determinants of health, where they grow up, where they live, where they go in and work every single day, and where they live and grow old, where they age. So these circumstances are shaped by how much money comes into the community, how much power our community have to fight for our communities, and the resources that are available in our communities. So if we don't have fresh fruits and vegetables and produce and things like that that are easily and readily available in the community, then that puts you at a health risk. But it also talks about food deserts. It talks about education. It talks about life expectancy. So all these things directly affect social determinants of health. And they're important to be able to have these resources in order to have a healthy life or have a chance at living a healthy life. So we talked about availability of resources to meet our daily needs. So think about it. If an individual doesn't have housing or difficulty affording housing, then it's going to create stress situations which directly affect your health. Access to education, to money, to job opportunities, all these things are stressful. You don't have a job, you can't work, what do? Right? Access to healthcare services. So if you're in a community that it's very difficult for you to get a doctor's appointment within your community with resources that are equally compatible to other communities with resources, then it puts you at a health risk because your services are suboptimal. Availability of community-based resources to support living, recreational or leisure activities. You know, you may want to go for walks and you feel like in my community, this is something that I should not do. Transportation. So if a person doesn't have a car, we talk about COVID-19, if you don't have a car and you have to travel based on shared resources, then you are putting yourself at risk for COVID-19 and other susceptible diseases. Public safety, social support. You know, what services or social support network do you have or have access to? And lastly, exposure to crime. You know, some people just may feel like I don't leave my home because I'm fearful of the crime rate that's in my community. So now, let's look at the percentage of communities that have been affected by COVID-19. So you may have heard in the media, Black residents make up approximately 29% of the Chicago's population. However, 72% of city residents who have died in Chicago, right? Blacks are 52% of those tested positive, and health disparities and access to care, we know, play a key role. So it's very, very important of having access to healthcare services based on those social determinants we just talked about. But also from our communities. Essential workers, many essential workers come from minority communities. Racial inequalities, that's a huge factor in terms of the number of deaths that have been contributed to COVID-19. So there's a map that you have. That map is really illustrating to you through a color code system the number of individuals and from the communities in which they live that have been impacted and died by COVID-19. And if you look at that map, you can see that most, and I should ask you, but most of the colors that stand out are that purplish color, right? So that purplish color represents Black, non-Latino Chicagoans who have died, Illinois who have died from this disease. That is Chicago now. Okay, so now that I've given you all of that information, let's have another question, get you back engaged in what's going on here. So what are some signs and symptoms of COVID-19? A, fatigue or tiredness. B, nosebleed. C, fever and or a dry cough. Or D, A and C. Very good. I didn't trick you all on that one, did I? So the answer is A and C. And so the only one that's incorrect is a nosebleed. No one has heard of anyone reported a nosebleed, and I have not seen that in any of the data either. Okay, so the signs and symptoms, and this is from the Census data, has shown that the signs and symptoms are fever, tiredness or fatigue, a dry cough, right? Shortness of breath. And but on average, these symptoms can start to appear as early as 5 to 6 days. However, we tell people to give it 14 days because you may have the symptoms and they can be so subtle that you don't realize that they're really the symptoms, but actually all the way up to 14 days, an individual, if they have been exposed, will definitely start exhibiting some of those symptoms. Other symptoms include aches and pain, So this could be generalized all over your body, aches and pains. Some nasal congestion, a runny nose, sore throat, and diarrhea. But recently we found out that there's other issues that could be also related to COVID-19 and help individuals with understanding and knowing that they may have the disease. Let's go into the rashes a little bit. So now there is something that is called the COVID rash. It can be a hive-like rash, like the picture you see in the upper right. It's an itchy rash, and it contains these little tiny red marks. It can be anywhere in your body, your chest or all over. And they love patches on the skin. But it's mostly on your body. But it can be some cases where it's found actually on the palms of the hand. The average length of days that this rash lasts is 7 days. And it's mostly associated with severe cases of COVID-19. And it's found from the studies in 19% of cases that have been reported. Okay. There's also a maculopapular rash. We call it maculopapular because it's a full surface area that you see this redness. It can cover the hand, it can cover the arm, but it's an itchy rash also. And it appears at the same time that the symptoms come. It resembles what we usually speak of as like a febrile rash. It really resembles that type of rash as well. It's associated with more severe cases of illness. The average length of this one is 9 days, and it's most commonly reported, is the most commonly one that has been reported in the studies. And it's found in, guess what, 47% of the cases. This rash is called chilblain, or also COVID toes. I don't know if you all have heard of COVID toes, but this is the rash that they're referring to. This is also an itchy rash, and it can be painful. It's found in 19% of Spanish cases, primarily affect young people, and is associated with a mild infection. Appears later in the illness, and it lasts for approximately 12 days. 12 days. This next rash is a blistering rash. So this one consists of these tiny little blisters that come on your skin. When we say blisters, they're like little papules that are filled with fluid. So they're blisters. They're found on either your stomach or back. And some patients have reported it being on their arms, as well, arms and legs. Primarily affect middle-aged patients, appear earlier than other symptoms of COVID-19. Lasts on average for approximately 10 days, and it has been found in only 9% of the cases reported. So libido, or another word for this, is called necrosis. Necrosis means death of a tissue. So the signs are like poor blood circulation. The skin may look purplish. You may see like a lace pattern on the leg, like you've probably seen people that have that lace pattern. This is found in more older patients, so the older population with more severe illnesses. It's found in 6% of COVID-19 cases so far that has been reported in this study. So this is new data, and this is very, very valuable information because guess what? Our hard-to-count communities may not have heard of this. They may not know that someone with a rash could actually be exhibiting COVID-19 and have milder symptoms and not think that that's something that needs to be reported. Okay, so let me get you back engaged. Let's have another question to see what you think as we continue to proceed through this. Which of the following is not? We're looking for not now. So this is an answer that is not correct. A recommended form of protection for COVID-19. A, wash your hands often for at least 20 seconds. B, avoid close contact with people who are sick. C, share your mask and other protective devices with family members. D, cover your mouth and nose with a cloth face covering when you're around others. I'm looking up. looking
You
at.
said the one that's not?
That's not correct.
The one that said we're gonna share with my friends.
Okay, that's correct. You should not be sharing anything with anyone. You know, family members are also included, because family members go to work every day, or they're leaving out their homes, and just treat everyone as a suspect. You know, as much as possible, you don't want to take that risk. All right, so basically, these are the CDC COVID-19 protection recommendation. My glasses. Okay. So you want to make sure you wash your hands often, and when you wash your hands, it should last for about 20 seconds. You know, sing a song or something. Mary had a little lamb, Jack and Jill or something. But don't just stick your hand under the water, wash and take off, or you still have that germ. You really need to go for about 20 seconds. Avoid close contact. So the recommendation is that you be at least 6 feet from the next person. And remember earlier, I said when you sneeze, it can go 6 feet. You can project, you know, depending on how powerful that sneeze or cough is, you really can spray someone, right? So cover your mouth and nose with a cloth face covering when around others. Clean and disinfect often. You know, so disinfecting your hand, cleaning tabletops, all those things are very, very important. If you're not feeling well, stay at home. Okay? I'm sorry. If you're not feeling well, stay at home. Do not go around people and expose others if you're not feeling well. But at the same time, seek medical care. So if you're not feeling well, stay home, call your primary care provider. Take care of yourself. And when I say take care of yourself, when you're not feeling well, you should get rest. Let the body rest. You know, COVID-19 has given us all a lot of rest. We've been home for a long time, right? So rest, okay? And also you want to stay well hydrated. Drink plenty of fluids to flush whatever's in your system. Okay, stay in touch with your healthcare provider, as I mentioned. Avoid public transportation. Because if you know you're sick and you get in a crowded place, you're going to infect everybody else that's around you. So separate yourself from others. Monitor your symptoms. So I told you what the early signs look like, right? So now you want to monitor if those symptoms start to change. Make sure you cover your cough and your sneeze, and now you know why. Avoid sharing household things, and now you know why. And do not share even dishes or drinking glasses with others. And clean all high-touch surfaces like doorknobs and things like that often with a disinfectant. All right, let's do another question. I don't want to lose it. Let's stay engaged. So what about testing? That's a question that may come up, you know, to you often. People may ask you, well, how do I get tested? What do they do? How is testing performed? Right? So let's do this. Is testing a nasopharyngeal swab inserted in both nares? So a nasopharyngeal swab is a swab that goes through the nose all the way back to the pharynx. So that's all the way in there. That's a nasopharyngeal swab. An oral pharyngeal swab is inserted in the mouth and throat. That's B. So they go through the mouth and they go all the way back to the back of the throat. Is that the test? Is it C? A nasal mid-turbulent swab inserted in the middle of the nares. So what I mean by that, the swab only goes here. And usually the person is given to the person. They're not going to go all the way back there and put it right there. And D, anal swab, anterior swab. Swab is, you know what anal swab is? An anterior swab inserted in the front of the nares, so right there at the opening of your nostrils. Or is it all of the above? What is it? Let's see. No guess? No guess?
It seems like it should be all of the above.
I'm torn. Everybody's torn. Well, guess what? Because you don't have a E anyway. We only gave you up to D, right? Yeah. But yes, it seems like it, and it is. It's all of the above. And I guess I was doing a giveaway back then, showing you how we do it and how they get up there. But the pictures that you see on this page is illustration of how the tests are actually performed. And it is, all of these different methods are correct. Yes. And these methods were approved by the FDA. So all methods have been approved equally. However, the number one method in which it's been used to test for COVID-19 is the nasal pharyngeal method, which is A, all the way back. But all methods are approved by the FDA. Question. So what should you do if you test positive for COVID-19? What do you think you should do? Should you stay at home and monitor your symptoms? Should you go to the hospital immediately? Should you call all family and friends and let them know that I'm sick? Or should you go to the drugstore and stock up on all meds? What do you think you should do?
Yes.
Please answer. I'm waiting.
I would say stay at home and monitor.
So hold your card up. That's A.
Yes.
Absolutely right. So I think it's coming in. You see how this interaction is working? You're getting it. Yeah. You just stay at home and monitor yourself closely. Yeah. And I'll tell you when to leave home, okay? We're going to get to that too.
Okay.
So what steps should you take if you have positive test results? What should we do if the test is positive? So basically, like you said, it's positive. You may not have no symptoms. You just have a test. They're very mild symptoms, or for some reason you got tested, but you don't have any symptoms or you have very mild symptoms. Just stay at home. Most people with COVID-19 have very mild symptoms, right? And they just, what we expect is that you just recover right at your home, right there. That way you're isolating yourself from contaminating other people. So don't leave your home, okay? And definitely don't go visiting public places. So take time for yourself. Like I said before, you want to get some rest, you want to sleep, watch some movies, take advantage of this time and keep hydrated, right? If needed for mild symptoms like headaches or body aches or something like that starting, just take Tylenol. Acetaminophen, we just treat the symptoms. Communicate regularly with your healthcare provider. Let them know what's going on with you and that you're doing okay or not. So if the disease it seems like it's starting to get worse, you still want to keep that line of communication open with your healthcare provider. But at all costs, please try not to use public transportation. And I think I should take this time to talk in hard to count communities. That's what I'm saying is very difficult. Because if you don't have a car and you can't get around, it's hard to say don't use public transportation. But the key here is you have to say, I'm sick, isolate, call a friend. Now you call a family member or someone else who can go out on your behalf and get these things and bring them to you that you need. Monitor your symptoms closely. I also provided for you a site, and this is provided by the city. It's called www.chicago.gov/COVID-coach. So a person who has COVID-19, if you're feeling anxious and you feel like, I'm afraid, I may not monitor myself the right way. This is a site that you can go on, register, and then they monitor your symptoms. And it's like you have your own personal coach to help coach you through this. And if the symptoms are getting worse, this coach will be able to say, okay, now is the time you probably need to go on here. Okay? But you do need to know, one of the key areas that we're very concerned about is difficulty breathing. So if you're home or anywhere you're having difficulty breathing, having chest pain, this is a time to go. But you don't just go. You call ahead and say, I'm not feeling well. I think I may have COVID-19. I'm coming into the emergency. They'll be prepared for you. So the next slide talks a little bit more. Let's go more in depth about seeking emergency medical attention. So if you're having trouble breathing, if you have this persistent pain or pressure in your chest, if you're starting to have confusion, that could mean that you've been oxygen deprived to the brain. You're starting to get confused about things. You have an inability to wake up or stay awake. Those are scary signs, Or your lips are becoming blush and your face is becoming blush, So these are extreme symptoms And during these times, you're supposed to go to the emergency room, alert them that you're coming, and if possible, have someone to assist you with getting there. You do not, again, want to use public transportation. Okay, so the next slide is a different color slide for me, and it's done this way for a purpose. So seeking medical attention. So let's say you just don't feel well, but you just want to be tested. You know, you don't know what's going on, but you want to get tested. So on the west side of Chicago, there are multiple test sites that you can go to and receive testing if you suspect that you have COVID. Loretta Hospital is a site, Walgreens, Rush Oak Park, or if you just want to have a virtual visit, you also can visit us at GreenBax Health Solutions. We perform virtual visits that we can also tell you what's going on via that route. No testing is done at that site, so I recommend any of these other sites that are in close proximity that you can go to. So in this sense, this is information now, again, that you have that you can share to our hard-to-reach community to let them know there are resources right here in our communities. Okay. Next question. So what should a resident not do if they have symptoms but tested negative for COVID? Have symptoms, but they tested negative. You all have that? Okay. So A, relax and go back to regular daily activities at work and with family and friends. Continue to follow distancing guidelines and wash your hands often. The virus probably was not present at the time of the test, but you can still get sick later. C, monitor your symptoms for worsening symptoms. There's a very small chance that your COVID-19 test results could be wrong. This is called a false positive or a false negative. Or D, schedule appointment with healthcare provider, virtual or in person. This is what you should not do.
Oh, no.
Remember that word. This is what you should not do. 5, 4, 3, 2, 1. Do you have an answer back there? Okay, the answer is A. Of course not. You should not relax. Never put your guard down. You have symptoms. You know, you're not feeling well. All the tests, and if you're listening to any of the media lately, you're finding out that many tests are coming back, and they're saying they're negative, and then they wait and they go back again in another 2 weeks, and the test is positive. So no, if you go and they tell you that you're negative, but you're having symptoms, don't trust it. You still stay home. So you stay home. We're going to get to that too. I don't want to just jump ahead of myself. Right? So always remember that. You don't feel well, you stay home. And if your employers are telling you to come to work, you don't go. What do? You seek out your healthcare providers. You need a medical clearance to go back to work. If you need a sick statement, you know, you have power in education and in knowledge. Know that you can stay home if you're not feeling well, and you visit your healthcare provider, which you should be contacting anyway, who will tell you stay home. Okay, and when you are ready to go back to work, guess what? Your job is going to request it anyway, so then you'll get a clearance. So we know that you are safe to return back to work around people. So, tested positive. This is a person who tested positive and they have symptoms. Tested positive and they have symptoms. So, how should they manage their home isolation? How should this work? So these are the CDC requirements again, as to what you should do if you test positive and you have symptoms and have been home on isolation. So all 3 of these bullet points have to be present before you can leave isolation. You have no fever for at least 72 hours, and this fever, no fever for 72 hours, have to be without the aid of medication. Meaning that you're off meds, you're off everything, you have no fever now for 72 hours. You've seen an improvement in your symptoms. For example, you have no longer shortness of breath, You no longer have a cough. You're not sneezing. Everything is so mild that you have definitely an improvement. And now for at least 10 days, you're symptom-free. Now I'm going to clarify this because some people get confused when I say 72 hours with no fever, right? But at least 10 days symptom-free, right? So if you, for 72 hours, you stop, that's included in your 10 days, then it's showing that you've been a consistent 10 days doing better and no symptoms. What about test for cure? That's also an isolation method. The test for cure process works like this. Also, you must not have a fever, and that fever must exist with not taking any medication. You must have an improvement in your symptoms, the same as before, no shortness of breath, no sneeze, no cough, you just feel like you've improved. But the change here with test for cure is that you have to have 2 consecutive negative test results at least 24 hours apart. Now, it can be more than 24 hours, but it has to be at least 24 hours apart. Okay, so now you tested positive, but you have no symptoms, but you're home on isolation. So the requirement from the CDC is really just 2 steps. You have at least 10 days that has passed that you, from the date of your positive test. At least 10 days have passed, and you continue to be symptom-free. You continue to not have no problems, you're not feeling any illness or anything like that. Or you can do the 2-point test for cure. And that test, those 2 tests have to be at least 24 hours apart. Is everyone nodding that you understand? Okay. All right, so that brings us to our conclusion. These are your take-home points. I want you to know that COVID-19 is a deadly disease, and it should be taken seriously. So even as you deploy or give or share this information with anyone, you want to make sure that you stress it at that level. COVID-19 is deadly. It's killing people, and it's serious. So we in our community should not play with it. We should take it as what it is. What you see in the media, the death numbers and rates, they're real. These people have truly lived out our world. And social determinants of health has definitely shown a correlation, has shown a relationship, has shown that social determinants of death and COVID-19 has a relationship, and it's a negative relationship, meaning that in our communities where we don't have the resources to be equally comparable to other communities, is putting us at risk and we're losing our lives. That needs to be shared. People need to know that. And because we don't have those resources, let's protect ourselves by staying indoors, right? Skin rashes. Yet these are now proven facts and symptoms of COVID-19. So people need to know that. You can see someone who's around you that's sweating and they have a rash. 6 feet is not even far enough, right? Run. But explain to them, you may have COVID-19. Someone may be calling you and just saying, you haven't had this rash for so long, I don't know what's going on. You may have COVID-19. You need to get checked out. Call the healthcare provider. And just know, as our city states, staying home does save lives. If you're sick, seek medical advice. If you're sick and it's of an emergent nature, you really need to go to the emergency room to save lives. And with that, we're done.